expedition cruise through the icy waters of Antarctica was supposed to be the journey of a lifetime. Instead, it has triggered an international health alert that is now drawing attention across the continents. The expedition cruise ship MV Hondius, carrying 145 passengers and crew from over 20 nations, left Ushuaia, Argentina in early April for a journey through some of the world's most remote waters. But weeks later, several passengers developed severe respiratory illness. 3 people have died, others remain under treatment, and health agencies across the countries are now tracking passengers who disembarked from the ship. Well, the virus behind the outbreak, Hantavirus, specifically the Andes strain. Well, the news has triggered global anxiety and inevitable comparisons with COVID-19. A cruise ship, international passengers, rising cases, and the similarities sound alarming. But health experts say that this is very different from the coronavirus pandemic. Well, what is hantavirus? Let us understand about it. Hantaviruses are a group of viruses mainly carried by rodents such as rats and mice. Humans usually get infected after breathing in virus particles from rodent urine, saliva, or droppings, especially in dusty or poorly ventilated spaces. And it is not a new virus. Different hantavirus strains have existed for decades in several parts of the world. Some affect the lungs, causing hantavirus pulmonary syndrome, that is HPS, while others damage the kidneys. The strain linked to the cruise outbreak is believed to be the Andes virus, found mainly in South America and known for causing severe respiratory illness. Well, what happened on the cruise ship? According to the reports, passengers aboard the MV Hondius initially developed flu-like symptoms including fever, fatigue, and body pain. And in some cases, the illness rapidly worsened into severe breathing problems. And by early May 2026, around 7 to 8 cases had been linked to the voyage, with 3 confirmed deaths. One patient in South Africa was reported to be critically ill, while others had milder symptoms. Because passengers had already travelled onward to different countries, and authorities launched contact tracing efforts as a precaution. The ship is now reportedly heading towards the Canary Islands under strict health monitoring protocols. But can hantavirus spread like COVID? This is the biggest question, and experts say that the answer is no. Most hantavirus strains do not spread from person to person at all. Infection usually occurs directly from rodents to humans, and the Andes strain is one of the rare exceptions, where limited human-to-human transmission has been observed in the past outbreaks. But even then, spread required very close and prolonged contact, usually among family members or caregivers. And it does not spread easily through casual interaction, public spaces, or airborne transmission like COVID-19. And that makes a major difference. Unlike coronavirus, hantavirus has never shown the ability to spread rapidly across communities or countries through everyday contact. But what are the symptoms and risk of the virus? Symptoms can appear 1 to 8 weeks after exposure. Early signs resemble the flu, fever, chills, muscle aches, headache, nausea, and tiredness. And in severe cases, patients develop coughing, breathing difficulty, and fluid buildup in the lungs. And the disease can become critical very quickly. Some hantavirus strains have fatality rates between 30 and 50% if treatment is delayed. However, early hospital care significantly improves survival chances. And there is currently no widely available vaccine or specific cure. But should the world be worried? Health authorities, including the WHO, say that the current risk to the public remains low. And so far, this appears to be a contained outbreak that is linked to the one ship, not a fast-moving global threat. And experts stress that this is a serious medical incident, but not the beginning of another pandemic. But for now, the best protection remains simple. That is, avoid rodent exposure, maintain hygiene in potentially infested areas, and rely on verified health information instead of panic-driven speculation. That's all for now. Stay tuned to the Savera for more updates. Do like, comment, and subscribe to the channel.